This afternoon in New Brunswick. Good morning to those who are in an earlier time zone. Today, I'm joined by my colleague, Minister Omar Alghabra, and Dr. Howard New. I want to thank Canadians who've made their appointment to get their vaccine. Canada remains in the top 3 of G20 nations for overall numbers of vaccines administered. Environ 58% des adultes
Approximately 58% of adults have received at least a single dose, and this figure will continue to climb. We are distributing a cumulative total of over 25 million doses to provinces and territories here this weekend, and millions of other doses are en route.
to receive vaccines for all eligible Canadians to receive their first dose by the end of June, and for all eligible Canadians to be fully vaccinated by the end of September. So, as always, we encourage all of you to get your vaccine when it's your turn. As we head into the long weekend, it is now as important as ever to continue to follow the local health authority guidance. By doing so, we will ensure that there is not an uptick in the number of cases, and we will also be able to beat COVID-19 together. So I now turn to my colleague, Omar Alghabra, and then Dr. New. Omar.
Merci, Dominic. Hello, everyone. Good morning, good afternoon. Bonjour à tous. Our battle against COVID-19 continues. On April 22nd, Transport Canada issued a notice to ban all direct commercial and private passenger flights from India and Pakistan for 30 days based on public health advice to reduce the importation risk of COVID-19 and its variants. We are now extending this measure through June 21st. Les vols directs de l'Inde et du Pakistan sont
Direct commercial and private passenger flights from India and Pakistan will continue to be denied permission.
India and Pakistan will continue to be denied permission to arrive in Canada. We're also extending the third country pre-departure testing requirements for these countries. This means that passengers who depart from India or Pakistan bound for Canada via an indirect route must obtain a valid COVID-19 test results from a third country, not India or Pakistan, before boarding a flight to Canada. These ongoing measures will remain in place to help protect Canadians and to manage the elevated risk of imported cases of COVID-19 and variants of concern into Canada. And I can say that we have seen a significant reduction in the number of positive cases of COVID-19 arriving from international flights since this restriction was put in place. There's still increased pressure on our healthcare system due to the pandemic, so we must continue to be vigilant. Canada currently has some of the strongest border restrictions in the world, with a strict 14-day quarantine, government-approved accommodation measures, and a ban on foreign nationals except in narrow circumstances. These measures also remain in place. They are based on a range of data and advice from public health experts. Our government's measures have resulted in a 96% reduction in air traffic and 82% reduction in land traffic into Canada. This has significantly reduced the importation of COVID-19 into the country. We're also constantly adapting our border measures in response to new evidence and will continue to do so as the situation evolves. Our government's top priority is protecting Canadians' health and safety. And our response to the global COVID-19 pandemic has always been guided by the latest science and research, and it will continue to be. As vaccines roll out across the country, public health measures remain the foundation of our pandemic response. Vaccination is one of the most effective ways to protect against COVID-19. When it is your turn to get vaccinated, please do so. We must get our vaccine rates as high as possible. And this way, we can end the fight against COVID-19. Ensemble, nous allons
Together, we can end this fight against COVID-19.
Thank you.
Thank you, Minister. Dr. New, over to you.
Okay, thank you very much. Merci. Et bonjour à toutes et à tous. Nationally,
Hello, everyone.
disease activity is steadily declining, but with the long weekend coming, we'll need to maintain precautions to sustain our progress and avoid a post-holiday spike. Over the past 7 days, we've seen a more than 25% decrease in daily cases, with a current average of just over 5,000 new cases being reported daily. Although the number of people experiencing severe and critical illness remains elevated, these numbers are coming down as well. Compared to last week, there has been a 10% decrease in the number of people with COVID-19 being treated in our hospitals each day, for a daily average of under 3,500. Of these, on average, just over 1,300 were being treated in intensive care units, which is down 4%, and an average of 41 deaths, down 15%, were reported daily. Sur le plan de la vaccination, nous accomplissons des progrès.
On the vaccine front, we are making phenomenal progress. In just 5 weeks, we've doubled the number of COVID-19 vaccine doses given across Canada, from 10 million doses administered by mid-April to almost 20 million doses administered to date as of today.
We are making phenomenal progress. In just 5 weeks, we've doubled the number of COVID-19 vaccine doses given across Canada, from 10 million doses administered by mid-April to almost 20 million doses administered to date as of today. Our actions this long weekend could not be more important. COVID-19 resurgences have followed social gatherings during past holidays and long weekends. With the important work we have left to do, this long weekend is not the time to let our guard down. Regardless of your vaccination status, follow the advice of your local public health authority, choosing lower risk activities and settings and keeping up with essential precautions will protect the progress we've made and set us up for a better summer and a safer fall. At the same time, we need to support our physical, social, and mental health needs, and spending time outdoors can help. This long weekend, having a family hike along your favorite trail, taking in the sights and sounds on a walk around your neighborhood, or enjoying a household barbecue in your backyard are among the many ways to enjoy the simple pleasures of the great Canadian outdoors, while keeping up with physical distancing and other precautions. Remember, unless you're with household members only, wearing a well-fitting mask is essential indoors or when outdoors and close to others. Working together, we can end this pandemic and get back to the connections and activities that enrich our lives and well-being in Canada. Thank you. Merci.
Thank you. We will now open the floor to questions. Merci. Nous passons maintenant à la période de questions. To give everyone a chance to participate, please limit yourself to one question, one follow-up. Please begin your question by identifying yourself and naming the outlet you represent. Alors, afin de donner la chance à tous les gens de participer aujourd'hui, veuillez vous limiter à une question et un suivi. Et veuillez, s'il vous plaît, commencer votre question en vous identifiant et nommant l'organisme de presse que vous représentez. Opérateur, nous sommes prêts pour notre première question. Operator, please proceed with our first question.
Thank you. Merci. Our first question, notre première question nous vient de Catherine Lévesque avec la presse canadienne. Please go ahead. À vous la parole.
Thank you very much.
Minister Alghabra, just about your announcement today, I was just wondering on what basis you're continuing to extend the suspension from flights from India and Pakistan. I don't know if maybe Dr. New would also like to comment on those things.
Thank you for the question. I'll certainly ask Dr. New to comment further, but I'll just say our initial decision last month was based on data observed through public health because of the measures that are in place, because of the testing regime that we have. And the data had shown a disproportionate amount of percentage of infection for arrivals coming from both India and Pakistan. And the decision was, as we had promised Canadians, that we'll do whatever it takes to protect their health and safety. And it was a difficult decision, but it was a necessary decision. Now that, at the time of examining whether to renew or not, we know that this is not the right time to loosen any measures right now. So it has been, again, decided based on public health advice that this is not the right time to loosen any border control measures. So we've decided to renew it for another 30 days. Thank you.
Thank you, and it's a Dr. New, so I can just add to that from the public health perspective. Certainly, we've seen that the issue of variants of concern is obviously top of mind. If you look at the situation in Canada, I would say over about 70% of the new cases being reported are the variants, as opposed to what we call the initial or wild strain of the COVID-19 virus. So that's important to know. We have a work cut out for us, obviously, with the third wave to tamp down or put down the number of cases we're getting in many parts of the country. At the border, it's another layer of protection. It's all a matter of what we would call risk tolerance and risk management. As you've been sort of aware, the actual traffic in terms of the air traffic and land traffic has gone down substantially, and essentially it's only certain individuals, essential workers, are allowed to cross the border. Having said that, there's also obviously a pre-departure test in place. Obviously testing at the border, testing a period of time afterwards, the government accommodations and so on. We're keeping an eye out at what's happening at the border, because even though the actual testing shows that the percentage of people coming in to Canada, very low positivity. What we're finding right now, based on the latest data, is that it's about less than 1% of all travelers coming into Canada are testing positive for COVID-19. But if you look at the actual metrics, about half of those are actually the B117 variant, and also now there's a growing percentage for the other variant of concern, the B1617. So we're keeping an eye out. It's also an opportunity for us in terms of our surveillance to be able to track the variants and sort of the development, and it helps us in terms of looking at other aspects such as vaccine escape and so on. So it's important to have these measures in place, and we recognize that although importation of variants is a small part of what's happening with respect to the situation in Canada, anything we can do in terms of that added layer is, I think, important to do at this time. Thank you.
Thank you. Follow up?
Oui, merci beaucoup. Et j'aimerais me tourner vers vous, Monsieur Leblanc.
Mr. Leblanc, I would like to hear you speak on something the Brigadier General Brody said something yesterday, and a lot of people had a strong reaction. She said that we would receive less vaccine between now and the end of June than what had been forecasted. Can you confirm this and tell us? Well, I think we don't yet know the Moderna delivery schedule. Could you clarify on this? Thank you.
Merci à vous. Merci pour la question.
Answer. Thank you for this question.
Comme vous savez, on attend
As you know,
2 millions de
we are
doses
waiting
de
2 million Pfizer
tous les
doses to
semaines
arrive
en juin
each
et
week in
maintenant en
June
juillet.
and now in July as well.
Cette semaine seulement, nous avons reçu
Only this
au-delà
week,
de 4
we received over 4.5 million
parce
doses.
qu'on a reçu 1
We received 1,100,000 doses of Moderna today.
acheminé vers les
This will
provinces
be
au courant de la
distributed
fin de
to
semaine.
provinces during the
Nous sommes
weekend.
tout à fait confiants
We're very
que
confident
25 millions de
that
doses de
25 million
vaccins
doses
seront
of vaccine
acheminées vers
will
les
be
provinces par la fin de
shipped to the
semaine,
provinces
en autres mots, dans les quelques prochains jours.
in the next few days.
Nous continuons une discussion
We are
avec
continuing
Moderna
our
pour
discussions with
avoir des
Moderna.
précisions sur
We're
les
trying
millions
to
de doses que
receive
nous attendons
clarification on the
d'ici
millions
la
of
fin
doses
juin
that we are
de
waiting on
Moderna.
between now and the
Ma
end of
collègue
June.
Anita Anand
My
va
colleague
parler
Anita
aux
Anand
dirigeants de
will
Moderna
speak to
encore une fois
the
mardi de la
director
semaine
of
prochaine
Moderna on
pour
Tuesday
faire
of
le
next
point
week
que
in order
le plus
to
de précision que nous avons
say
quant à
that
l'arrivée des millions de
the
doses que nous
clearer we
attendons
are
de
on how
Moderna
many millions
au
of
cours des
doses will be
prochaines
sent
semaines.
by
Ça
Moderna over the
permet
next few weeks.
aux
This
autorités provinciales de
allows
planifier
provincial authorities to
leur clinique de
plan
vaccination
their rollout
et la
and their
générale Brody a bien
clinics.
indiqué
General
les
Brody
chiffres pour lesquels nous
indicated that the
avons
figures
une date de
for which we
livraison
have
certaine.
a firm delivery
Alors,
date.
le centre des opérations
So the
et la
Operations
générale
Center
Brody,
and General Brody,
quand ils sont en communication avec leurs
when
vis-à-vis dans les
they are
provinces, discutent seulement
discussing with
des
their
doses de
provincial
vaccins où la
counterparts,
date
are talking about
précise de l'arrivée est confirmée. Et nous
confirmed
travaillons encore
vaccine
avec
shipments.
Moderna
And we're still
pour
working
apporter
jointly
plus
with
de
Moderna
de visibilité possible sur l'échéancier
to
de l'arrivée des vaccins.
to clear up the timeline. We are confident that Moderna will be able to fulfill their obligations with regards to the millions of doses that we're waiting on over the next few weeks. This is the subject of continued discussion between Mrs. Anand, and once again, she will have a discussion with the leaders at Moderna.
Thank you. Merci. Our next question, notre prochaine question nous vient de Marika Walsh with the Globe and Mail. Please go ahead. À vous la parole.
Good morning, Minister LeBlanc. I'll follow up on Catherine's questions to you. Can you explain what has changed between April and now, so about 3 weeks, where the government was saying we could expect a minimum of 48 million doses, and now it's a minimum of 40 million. What changed with which suppliers and how much?
So as I think General Brody discussed, and as I just said in answer to your colleague's question, the Public Health Agency, General Brody with her counterparts in the provinces and territories, discuss the vaccine doses for which we have precise delivery date information. We continue to work constructively with Moderna to have more visibility and greater certainty around when the millions of doses we expect to receive from Moderna over the coming weeks will arrive in Canada. I would note that we received over 1 million doses of Moderna in Canada today. This week alone, we received almost 4.5 million doses if you take the doses from Pfizer and Moderna. We're extremely confident that in the weeks of June and July, over 2 million doses of Pfizer alone will arrive in Canada each and every week over the next couple of months. And as I say, we remain confident that some of the supply chain challenges and quality assurance checks, challenges around those processes that Moderna had will be worked out over the coming weeks. And we again expect the constructive collaboration we've had with that company to continue. And my colleague Anita Anand will once again be talking to the senior leadership of Moderna on Tuesday of next week to stress the point that provinces planning vaccine rollouts, obviously the greater certainty we can have around delivery dates, the easier it is for them to effectively plan.
Thank you. Follow up?
Thank you. Yes, thank you. Can you please confirm for us then if Moderna has said it will still meet its commitment? Like, yes or no, has Moderna said it will still meet its commitment of 10.3 million doses between April and June, and it's just now a question of when they come?
So again, maybe Dr. New can add some precisions. The information I have from my colleague Anita Anand is that we remain confident in Moderna's ability to supply the doses to Canada. The challenge is the delivery schedule is less certain, for example, than Pfizer has been over the last number of weeks or for the next couple of months. We expect Moderna to be a very key part of Canada's vaccination plan in every part of the country. And Anita Anand and our colleagues at the Government Operations Center and the Public Health Agency have had an ongoing and productive and reassuring dialogue with Moderna. But obviously, we understand the importance of having the most reliable information on delivery dates. But Moderna does have millions of doses scheduled for delivery in Canada over the next number of weeks. We just need greater precision on the specific dates of those deliveries. But maybe Dr. New has some additional information.
No, thank you very much, Mr. LeBlanc. No, nothing really more to add. It's exactly as you described it, that obviously at the logistical level with both Moderna and as well as obviously with provincial counterparts. My colleague, Brigadier General Brody, is in active discussions, and as you said, what she elaborated yesterday was in terms of precise dates for delivery, but in terms of anticipated and also planning for future deliveries. Those are active discussions which are ongoing. Thank you.
Merci. Opérateur, prochaine question.
Thank you. Merci. Our next question, notre prochaine question nous vient de Raymond Filion avec TVA. Please go ahead. À vous la parole.
Merci beaucoup. Une question pour le ministre Leblanc.
Thank you. My question is from Minister Leblanc. Right now, plans are on the table for ending the lockdowns. Why are you not presenting a plan for relaxing of the measures at the borders for business people, or at least a timeline? Other countries are doing this, and why is Canada not doing it? Answer. Thank you. Thank you, Mr. Filion. As my colleague, the Minister Alghabra, stated, we believe that now is not the time. Now is not the time to relax measures at the international borders. The measures with regards to screening tests and quarantine, mandatory quarantine, are crucial given the current context. We are following the recommendations made by doctors and scientists at Public Health Agency of Canada. We recognize that over the next few weeks, when the number of people vaccinated will rise, and if we continue to see a reduction in hospitalization rates and COVID numbers, we may be able to progressively relax these measures. In today's context, my colleague, Mr. Alghabra, has renewed the ban of direct flights arriving from India and Pakistan, and we will continue to implement necessary measures in order to protect Canadians with regards to these international borders. This is what the provincial premiers have been asking for a long time, and it has been the main objective that we have had since the beginning of the pandemic. Also, we have discussions underway, active discussions, with the U.S. authorities. My colleague, Minister Blair, discusses with his American counterpart in order to eventually, at the right time, to bring forth changes in the border situation. Right now, we believe it's important to maintain these measures that are essential to protect the health of Canadians. If Dr. New has anything to add, I will invite him to do that.
Okay, merci. Oui, c'est Dr. New. Merci, Ministre.
This is Dr. New. Thank you. The two main principles of public health are still in place, even if we're talking about what we can do at the international border. We try to look at the epidemiological situation, what is being done to control community transmission, and what is happening with vaccine rollout. If we can look at relaxing measures at the border, it's not just a question of the travelers arriving in Canada. We have to look at the situation within Canada, with Canadians in the country. Do we have a good situation with most of the population vaccinated to have a good vaccine coverage? What is the situation with community transmission rates? Is it manageable or not? Is our healthcare system overwhelmed or not? In some regions of the country, that is the case. All of these are factors and considerations that need to be taken into account. With the U.S. as well, it's interesting because for a few months, even the epidemiological situation has evolved a lot in the U.S. compared to Canada. The situation and also the vaccine coverage situation has changed as well. So all of this is part of discussions underway between governments. Thank you. Follow-up question? Yes, question. A lot of people are wondering if they're going to be able to travel to the U.S. this summer before Labor Day. What do you have to say to them? Maybe or no, forget it. Answer? Well, I will offer a comment, and as usual, if Dr. New wants to add something, he's welcome to do so. We are working with the Biden administration in order to have complementary measures at the border, at the U.S. border. These discussions are underway. Minister Blair discusses with his counterpart, and our ambassador and others are having this discussion at all levels with the American government. At the current time,
Thank you. Merci. Our next question, notre prochaine question is from Christian Ajikute from CTV News. Please go ahead. À vous la parole.
Hi there. This question is for Dr. New. I want to get your thoughts on this. Do you think there is a public health risk if people cross the border into the U.S. to get a vaccine and then return to Canada?
Thank you for the question. There's two parts. Obviously, I think, in terms of access to vaccines, I think, here in Canada, with many millions of doses coming into the country, I think, for lots of reasons, even logistically, administratively, I think it's probably easier and better for Canadians to wait their turn. Obviously, then it'll be easier in terms of being sort of put into the vaccine database based on an appointment and getting their vaccine here in Canada. I would say that if you were to travel to the United States, there's always more opportunities to come in contact with more people. Passing through the border, coming into contact with additional people, and then passing on your way back. At this point, I think even from a technical, scientific point of view, if you were to get a vaccine in the United States, it doesn't guarantee that suddenly you're going to have your immunity. You might still be in the incubation period, and therefore, that's why we still require anyone who comes back into Canada or comes to Canada for the first time needs to go through a strict 14-day quarantine period, because we all know that someone could pick up an infection, be incubating, and it could certainly declare itself as illness several days after the fact. And even if you were to get a vaccine, you could be in the midst of your incubation period. Or even the vaccine itself, it takes at least 2 weeks or more before you get full immunity in terms of at least that first dose, let alone the protection that you would hopefully get after getting your second dose. So for lots of reasons, to me, from a public health perspective, it just makes more sense. Just wait here in Canada and get the vaccine here. If let's say there are other doses, let's say in the United States that they wish to donate to Canada and so on, that's not really for me to speak to. But certainly, if more vaccine were available here in Canada, then I think that would also, certainly assist the provinces and territories in terms of their vaccination programs and rollout of vaccines. Thank you.
Thank you. Follow-up?
Thank you, Dr. New. And this question is for Minister LeBlanc. Brigadier General Brody said 40 million Moderna vaccines. The government said 48 million Moderna vaccines. Which number is it? The public needs a number on this, sir.
So obviously, Brigadier General Brody and her colleagues at the Public Health Agency speak only of the vaccine doses for which we have precise arrival dates. That's why the 40 million number was used. It's 4.5 million vaccines we've received this week. As I said, it's at least 2 million Pfizer doses every week in June and again into July. But Moderna will continue to deliver the millions of doses we expect from them over the next few weeks towards the end of, up until the end of June. As I said, my colleague Anita Anand has a meeting with senior executives at Moderna on Tuesday, precisely to make the point that the delivery dates are important for our partners in provinces and territories. But we remain confident that that 40 million number will increase to reflect the doses we expect to receive from Moderna. But if we don't have a precise arrival date yet for those additional doses, the Public Health Agency and the Government Operations Center, where Brigadier General Brody is working, will not speak of those specific numbers until we have greater clarity on the arrival dates. But we expect to have that information updated again next week. So we're confident that Moderna will continue to supply the millions of doses to Canada over the next number of weeks as planned.
Merci. Opérateur, prochaine question.
Thank you. Merci. Our next question, notre prochaine question, is from Laurence Martin avec Radio-Canada. Please go ahead. À vous la parole.
Oui, bonjour. Avant de poser je me demandais,
Mr. Leblanc, could you finish answer the question that was asked by Mr. Fillon? Is it a good idea for Canadians this summer to expect to be able to travel to the U.S. before Labor Day? Answer. Thank you, Mrs. Martin. We've always said that now is not the time to plan a trip. We recognize that Canadians are quite impatient and that they would like to be able to plan and to talk about vacation planning, and we do this in our families as well, to talk about potential travel later this summer or in the fall. We will continue to follow the evolution of COVID cases in Canada, as Dr. New explained, including the percentage of cases that are being screened as being variants, COVID-19 variants, to look at the vaccination coverage rate as well. We are confident of the ability of provinces and territories to administer vaccines. As we said, today, we are confident that millions of vaccine doses will arrive over the coming weeks. At the right time, we will have more information as to this question of travel, either to the U.S. or elsewhere. Right now, provincial authorities don't allow someone in New Brunswick, where I am sitting here today, to go to Nova Scotia. So I can't go visit my wife's son in Halifax. It's a 2.5-hour drive from Moncton. I don't think that Canada is ready to discuss specific measures with regards to international travel, including to the U.S. We do recognize everyone's willingness and wanting to reach that point. We will continue to follow the advice of experts and doctors in public health. We hope that we will have more clarifications with regards to these types of travel over the next few weeks, but not today. Question. So why is it that Canadians coming back from overseas or tourists that have received 2 doses of a vaccine, they are immunized, why do they have to quarantine 3 days in a hotel? Answer. I will make a comment and then Dr. New can add. Once again, we are waiting for the results of clinical trials and scientific data. We don't know if vaccinated people can infect other people with COVID-19. I have read some reports that vaccines might halt the transmission. We do want to discuss these types of issues with our partners, whether it be our European or U.S. partners, for example. We recognize that this is a natural evolution of our position on what's happening at the border. But on the Friday of a long weekend, we are not about to change our position. We recognize that scientific data will evolve over the next few weeks, and this might allow us to change the rules with regards to fully vaccinated people in a quarantine. Dr. New is able to provide more scientific advice and the possible evolution. Howard.
Okay, merci, Ministre Leblanc.
Thank you to Minister Leblanc. You explained the situation very well. Perhaps I can speak to 2 other aspects. On the science side, we know that no vaccine is 100% effective. It's always possible for someone, even someone who has received 2 doses, to be infected with COVID-19 and is able to transmit the virus to other people. We don't know how long immunity will last. Many scientific questions remain unanswered. Another important aspect to this, it's not really an issue of people with the 2 vaccine doses. It's rather to see what happens with vaccine coverage and herd immunity for the Canadian population. We're doing excellent work, but we have not reached 75% of vaccine coverage with at least 1 dose here in Canada. And afterwards, we, of course, want everyone to obtain both doses of the vaccine. We have to look at what's happening with community transmission rates here in Canada and the vaccine coverage rate. A good example of this is what's now happening in the Yukon Territory. They have a strong vaccine coverage, and they're more confident that their population is well covered. Also, they have to follow public health measures. Community transmission rates are very low. They've now removed this requirement for travelers arriving with regard to the quarantine period. I believe that with the principle, it's important to look at what's happening with the Canadian population within Canada that is still vulnerable. Then we'll see what happens with the vaccination rate and community transmission rates before relaxing measures at our international borders. Thank you. Follow-up question? Yes, question. Dr. New, you say that a vaccination is not 100% effective, and it's possible for someone who is vaccinated to transmit the virus. But last week, you said we will be able to have a more normal life. Many measures will be lifted when 75% of Canadians will have received both doses. If we follow your logic, there will still be virus circulating throughout the population. When can we imagine a more normal? How can we imagine a more normal life when people have received both doses but not change the quarantine at the hotel? Answer. Well, I can't go into all the scientific detail, but we know that a greater amount of Canadians that will be vaccinated, as we say, there will be a certain herd immunity that will be reached, and then it's more difficult for the virus to make its way through a community. That's why we always say that it's very important to follow the epidemiological situation and also to continue with our health measures in order to control and reduce the infection rate in many regions in the country. And it has to be at a manageable level. We don't want our healthcare system to be overwhelmed. This is what's happening in Canada. But if we talk about the border, yes, we have to look at the risk. This is a concern. We want to do everything possible with many levels of protection to stop importation of COVID-19 cases in Canada. Right now, with what we know, we do have requirements, quarantine requirements. We don't know we don't know anything about incubation, and many questions remain unanswered. We need to do everything possible at the border. It's even more important to look at what we're doing within Canada with halting transmission in our communities and vaccine rollout.
Thank you. Operator, next question.
Thank you, merci. Our next question, notre prochaine question is from Tom Perry with CBC News. Please go ahead, à vous la parole.
Hello, thanks for taking my questions. First question is for Minister LeBlanc. I just want to just be clear here. Is the government bracing for delays in Moderna shipments, or is there a possibility the company just won't be able to fulfill its complete order of all the doses that Canada has ordered? And also, given the problems with Moderna and I guess the questions around AstraZeneca and Johnson & Johnson, are you still on track to meet that goal of having everyone who wants a vaccine fully vaccinated by the end of September?
Tom, thank you. Yes, the government is absolutely on track to ensure that every Canadian who's eligible and wants a vaccine, including, of course, eligible younger people as those eligibility criteria evolve, we're confident that that will be the case for every Canadian by the end of September. They will be fully vaccinated if they choose to be vaccinated, and we're obviously hoping that there'll be a very high uptake of the vaccines. The only challenge with respect to the numbers between now and the end of June, so over the next 4.5 weeks, 5 weeks, is the precise arrival dates of those Moderna shipments. So my colleague Anita Anand, as I said, is in active and encouraging, constructive conversations with senior executives of Moderna. Another meeting is again scheduled on Tuesday. So the reason the Public Health Agency or the Government Operations Center doesn't include those precise numbers is until we have a firm delivery date from Moderna over the next few weeks regarding the millions of doses we expect to receive, they're not included in that total. So we have every confidence that Moderna will be able to meet its obligations to Canada, but we recognize, obviously, the desire of all Canadians to know how quickly those will arrive so that those that are waiting for a first dose or people like me who will get a second dose of Moderna at some point will be able to have those appointments booked. And it's obviously the work that we want to do collaboratively with provinces and territories. But that work is ongoing and that work is very constructive as well.
Thank you. Follow up?
Alghabra, I'd like to know that on the flight ban, have you sort of laid out benchmarks, what it's going to look like, what conditions you're going to want to see in place before you lift that ban and allow flights to resume?
Thanks, Tom. As I said earlier, that we have committed to Canadians that we'll do whatever it takes to protect their health and safety, and that all decisions will be based on data and public health advice. So the benchmarks that we're looking at are obviously current situations here at home. The number of infections, the vaccination rate, the hospitalization rate, and we're looking at the situations at the countries of origin. So and the variants as well. So those are the factors that we look at. Obviously, public health and experts are looking at, and we will follow their advice and whatever the data tells us.
Thank you. We have time for one more question. Merci. Nous avons le temps pour une dernière question. Operator, over to you.
Thank you. Merci. Our next question, notre prochaine question, is from Michael King with Global News Calgary. Please go ahead. À vous la parole.
Hi there. For Minister Alghabra, Alberta's premier said he believes that the surge in COVID-19 cases in our province is linked to oil sand sites and all that's related to travel. In the last 2 weeks, with more than 40 domestic flights landing in Calgary with COVID-positive travelers, at what point do you start looking at the current screening for domestic travel? Does that need to get overhauled? And what more will be done to protect domestic travelers?
Thanks, Michael. And we have taken a lot of precautions at the international border. We've implemented layers upon layers of testing, of restrictions. And when it comes to interprovincial travel, as you know, provincial boundaries are the responsibility and the jurisdiction of the province. So we have reached out to all provinces. The Prime Minister, Minister LeBlanc, and others have spoken with premiers and saying, we stand ready to work with you on whatever measures you would like to implement for your provincial boundaries. So as I'll repeat, we stand ready to work with provincial governments. So just to give you an example, we are working with Nova Scotia, where Nova Scotia now has put measures on non-essential travel into the province. That decision, they made it themselves. And now we're working with them, we're working with airlines on making sure that passengers who are traveling there are aware of the new restrictions and that they need to get a letter prior to getting on a flight to go to Nova Scotia.
Follow up?
Yeah, again, on the airlines, we know that some airlines around the world are making vaccines mandatory for flight crews. A couple just came out today saying that. Is Transport Canada going to be putting similar regulations in place? Can they even do that? And if not, what sort of guidance are they going to be providing for airlines while navigating this issue with flight crews?
Thanks again for the question. When it comes to vaccines, from the beginning, the federal government has worked with the provinces. We committed to providing the supply, acquiring the supply, and we committed that we distribute it to the provinces directly, where the provinces are responsible for the administration of the vaccination. I want to repeat what I said. I want all Canadians who want to be vaccinated as quickly as possible. I want to thank all of them who had been vaccinated. I think if we haven't surpassed the U.S. yet in first dose vaccination, we're about to. So this is a great sign of how Canadians are lining up to get vaccinated. And when it comes to travel recommendations, we continue to say now is not the time to travel. We have implemented health measures for people who are traveling, for crews, and stay tuned for additional rules as we start, because eventually we're going to start opening up travel. So we're going to have new announcements, new measures, but right now we're focused on the third wave. We're focused on protecting the health and safety of Canadians, and our advice to continue to avoid non-essential travel.
This concludes today's event. Thank you for joining us. Ceci conclut l'événement d'aujourd'hui. Merci de votre présence.